Previously on Periscope Tales.
I have a plea to Governor Lamont. I have a plea to Governor Cuomo. We have to quarantine those who are coming from heavily infected states now, today. Make the order. Governors, please quarantine travelers from the affected states. We have to do it urgently.
Good evening. I'm Savannah Guthrie in for Lester, and tonight a deepening crisis as the coronavirus comes on strong across the South and the West. The map tells the tale. 13 states setting record highs for new cases in just the past week. And even more alarming, 7 states setting records for hospitalizations. The CDC today projected the death toll in this country could climb to 150,000 in less than a month. NBC's Joe Fryer leads us off.
Across the country, states are shattering coronavirus records with more than 36,000 cases today in the U.S., the highest one-day total yet. Today in Florida, a record 5,500 new cases, while California has seen a 29% jump in hospitalizations in just 2 weeks. And in Texas, the governor sounding the alarm, speaking with CBS affiliate KBTX.
Because the spread is so rampant right now, there's never a reason for you to have to leave your home unless you do need to go out.
In hard-hit Houston, hospital workers are frontline witnesses to the virus's deadly reach.
We learned that one of our patients who've been here with us for a while passed last night. That's really sad.
The spikes are so alarming, today's states hit hard early in the pandemic. New York, New Jersey, and Connecticut announced they'll require out-of-state visitors to quarantine for 2 weeks if they travel from a hotspot, a list that for now includes 9 states.
We don't want to see the infection rate increase here after what we've gone through.
Arizona is on that list, a state where hospitalizations are climbing. ICU beds here are now 88% full.
That's my biggest concern right now, is that with the trend line that we see, we're going to really be going over our hospital capacity.
Will Humble is the former director of Arizona's Department of Health Services. He says the state should have had more restrictions in place as businesses reopened.
And unfortunately, it has normalized pre-pandemic behavior.
Last week, Arizona's governor allowed cities and counties to mandate masks, hoping to slow the spread.
Now that I'm required, I'm wearing it a lot more.
But frontline workers are worried the worst is ahead.
We don't have enough nurses for these patients.
As a virus hotspot surges in the Sun Belt. Joe Fryer, NBC News, Phoenix.
Good evening, everybody. Good evening. This series gutted me, right? This series gutted me. I don't know how many of you are Yankees fans. I'm a pretty big Yankees fan. I know there are a lot of people that are Boston fans. I've got Hartford people. They're Boston fans. I have people that are friends that are up the line in New Haven. It's 50-50 split. Boston fans or Yankees fans. I don't have many Astros fans. Yeah, I feel bad for Houston. They're having a rough run of it. This is Dr. Murphy Medical Associates. I want to thank all the governors. I want to thank Governor Cuomo. I want to thank Governor Murphy. I want to thank Governor Lamont, who I personally have met with and know that he is a man of reason. And I'm really appreciative that they were paying attention to the numbers, that they were alerted to the fact that we're seeing numbers. Hi, Linda. That we're seeing numbers of people that are positive, that have positive travel history from an area that currently is a hotspot. We were a hotspot when we were in Westchester County, hotspot. Fairfield County, sort of a hotspot. We got ahead of it in Fairfield County, I think, with our drive-thrus in Stamford, which attracted a ton of the Westport hotspot. That Westport outbreak, we took care of most of those people. We tested them right away. We got them quarantined. In addition to that, Mark Cooper was even ahead of our Westport site. He was testing people right after we started testing people. So he rallied the contact tracing of the second round of, oh no, Hartford's not a hotspot right now. No way. Hartford is not a hotspot right now. So we've had some positive tests in a couple other cities, right? I'll let the public health departments handle that. We let them know. But most of it's actually travel related. It's not, I'm in Connecticut and stayed in Connecticut. It's like, no, I came from Florida and now I have GI symptoms and boom, coronavirus. Now I've tested the family members and we've done a little bit of the contact tracing there as well, working with the Departments of Public Health. So I want to thank the governors. Thank you, governors. Thank you for hearing the call that I was making. And I'm sure it wasn't just me. I'm sure that there are other towns that were reporting the same positivity issues. Positive with history. So this is why I think it's so important to have doctors doing testing, treating, isolating, and tracing, right? Let me tell you why. Because we do a medical history. We kind of take a little insight into that patient before we test them, right? And then we can guide testing accordingly, right? Sometimes we get blood work. Blood work can support the diagnosis. We don't ever make the diagnosis just on blood work, but we do use blood work to support the diagnosis of coronavirus. We can do that through an LDH or a ferritin level. We look for superinfections. And so blood is useful even with a swab. We never make a diagnosis based on an IgM level by itself. We just don't do that because there's cross-reactivity. But an IgM level plus a ferritin level plus an LDH, maybe. And if the PCR is negative but they have symptoms, probably. So we use blood work to we use blood work to support diagnosis. Especially in the face of a negative PCR with clinical symptoms. It could be a headache, it could be anything. Listen, if you think you know what this virus is, you're like me when I was 20 years old and figured out a way to beat the casino, right? I had a mathematical way to beat the casino. Yeah, wrong. I was just naive, right? And you are naive if you think you figured out this virus. No one has figured it out. We continue to learn more, but no one has the 100% picture. So to say things are excessive or whatever, that's sophomoric, right? Sophomoric and a little ignorant. And it's definitely not humble. It's more arrogant. We don't know what's going on here. So really nothing is excessive in my humble opinion, especially if there's literature that indicates that maybe you want to do some of this testing. Regardless, I want to thank the governors for hearing the call, the plea that I put out there, begging, do you think this will disappear when the election comes? Well, what do you mean by disappear? I mean, it's going to move through the states, Linda. It's going to be all over the place. We are going to have a quarantine requirement in the tri-state area for travelers. And that's the right thing to do. It's like wearing a mask. If you came from a hot zone, quarantine for 14 days, please. Or quarantine for 5 days and go get a test, right? We know that the first day after exposure and infection, there's a false negative rate of like 100%. It goes down subsequently over the days from infection. 3 days to 5 days from last interaction with people from Florida or from Arizona. I know, Linda, and we should totally do that. But I'm telling you, don't wait for me. Don't wait for me, Linda. So I was very happy to see the governors acted on our call. In addition to that, it was a very challenging day for many other states, so my thoughts and prayers go out to them. I want to reiterate something very important. Politics and healthcare do not mix. And I've said this over and over and over again. But the problem is, when there's money involved, and federal government is involved, and state government is involved, when you have to pay for care, then there's politics. Whenever there's money involved, there's politics. 99.9999999% of the time, when money is involved, politics is involved. It's just the way that it is, especially when there's limited resources. Limited resources, money equals politics. Like, we're talking blood sport politics. And I always try and stay apolitical with these things because I'm a big fan of personal liberty and personal responsibility. But if my liberty tramples on another person's, then that has to be handled. You can either handle it personally, and if you fail to police yourself, right? This is what happened in the professions. A physician who failed to police each other get regulation. Lawyers who cannot police their profession get regulation. If we cannot police ourselves, our own personal agency, if we can't police ourselves, then there's regulation. It's just the way that it is. So yes, that's where I was. I think that if we can be good to each other and do our best, a lot of this stuff shakes out. Today was a significant day for community spread in many states. The mortality rate goes down as more people get infected, especially people who are not sheltering in place, vulnerable people, right? So vulnerable people like nursing homes, or vulnerable people like diabetics, or vulnerable people that are obese. Now, you can reduce some of those things and that can really help you, right? You change your diet around, you can get your sugar in a better zone. We do know that there's some evidence coming out that says that this novel coronavirus, SARS-CoV-2, infects islet cells and pancreatic cells. And then there's inflammation that leads to insulin resistance, predominantly in adipokines, in adipocytes, which are fat cells that secrete a chemical called resistin at higher levels. When exposed to inflammatory factors, these cells increase insulin resistance. Well, what's insulin resistance? It means you don't manage sugar in your body well. If you can't manage sugar in your body well, you get high sugars. High sugars, diabetes mellitus. Just that simple. Just that simple. And so by burning fat cells with things like intermittent fasting, it spikes growth hormone. It improves a little bit of lean muscle mass. And so then we can help improve insulin sensitivity by increasing GLUT4 expression, right? We can increase insulin receptor expression, so we don't need such a high insulin level, right? I think where I find a lot of our evils are due to too high insulin levels and insulin response. So we know that this virus is bringing out all the worst in metabolic syndrome. So people who have metabolic syndrome should really not be out and about in these areas with high spread. So as people continue to shelter in place and that gets improved, spread continues because people don't wear masks and feel invincible, right? They feel invincible and they don't feel guilty because there aren't vulnerable people out there, although I'm here to tell you there are a lot of vulnerable populations that have been hit really hard with this that can't shelter in place. So we'll have to work on all of that stuff too. We saw yesterday instances of cases that came from Florida. And so the cases that came from Florida were positive. And so I pled to the governor. I said, please, let's institute a 14-day quarantine from hotspots. Yo, Tro, how are you doing? What's going on? I don't know whether you can hear me or not. Sometimes we add people, guests, and if anyone knows Dr. Tro, Dr. Tro is a pretty amazing doctor, right? He's a board-certified bariatric doc like myself, and he has been really dedicated to helping people lose weight, which in this coronavirus outbreak was huge. He probably saved some lives and didn't even know it, right? He maybe didn't even know it, right? I don't wonder how many of his patients that he had helped lose weight were positive for COVID and were able to survive that, right? I mean, so I think that's an important thing. The goal here is really to identify patients ahead of time. And one of the best things that happened was we are testing in our own lab. So by testing in our own lab, we're able to get the results right away, same day. You know, you don't need to do the results 2 days, 3 days, 4 days. by using our laboratory, we were able to test on time, get real-time data. And what we found was that travelers from Florida had some positivity. And so I was really glad the governor did that. So today, quite a day, right? We hit our all-time high record for number of cases in a day, unfortunately. And I think that was to be expected, right? Whether it's a combination of air conditioning, lack of proper mask wearing, social distancing, and then the youth, right? The younglings. I was worried about this in Connecticut and New York, and it was evident that that's the case. There's a level of invincibility. Your frontal lobes are not gelled all the way at 20 years old, so there can be some issues there too. But we're seeing spread that way. We're seeing a lot of spread. And how do we stop it? We have to encourage the youth to wear masks, especially in endemic areas. And those who are traveling, we need to encourage that if they come back into a zone that's any zone, right? Consider quarantining. Stay at home. Day 5 to day 7, go get a test. If your test is negative, you're probably doing okay. Looks like the guy with the food is here, so we can talk about food. I'd been avoiding food because I was worried about fecal-oral transmission. We found it in sewage, right? We found RNA in the sewage ahead of outbreaks. We found it ahead of outbreaks. So was as an early warning sign? Maybe. So we have been cooking a lot of food at home. I've been cooking a lot of food at home. But there are just some times that we've ordered out. And what do I do, right? So what do I think can denature viral particles, right? Well, what can I do to do that? Microwave will do that, right? Microwave will do that. Can we heat it and kill it, right? To kill whatever is there on very limited occasion, right? And I'm not really good at cooking ribs. I'm just not. You got it, exactly. Heat the food, right? So can we heat the food? Yes. Heat the food, kill the virus. That's probably the best thing that I can recommend if you're going to do it that way. Don't just grab the food and eat it, right? I mean, obviously wash your hands. It comes in containers. Wipe the containers down. Take the food out of the containers. Cook it, right? 160 degrees Fahrenheit. I think it's a very brilliant way to go. I've got Tro on here, right? Tro's right above me, but I can't hear him. So I don't know this Periscope thing. I don't know how it all works, but oh, you finally talk up, right? Finally, I can hear you.
Oh, you can hear me. Listen, can I ask you a question? So you can hear me.
What's up?
So, have you noticed any effect of using hydroxychloroquine earlier versus later in the course of disease? Not like early on. I know you're seeing like probably more cases in the Northeast than probably any other primary doctor. So, like early on in the diagnosis versus like later on in severe disease. Any difference?
So that's a reasonable question, right? That's a reasonable question. So as you know, the hospital that I round at took the privilege to take care of COVID patients away from primary care physicians. And they just used the hospitalists and the residents for that. But early on in the course, I actually had a patient who I had cared for, diagnosed early before they took those privileges away from us, that had COVID. And he had it for about 10 to 12 days. I put him on hydroxychloroquine. I don't think it did anything. It's purely anecdotal, Tro. Purely anecdotal. I don't think it did anything. That being said, I had another guy come to me, and I've had a bunch of these like this. We tested him in Greenwich really early on. One of the patients said, I had an exposure, and I just don't feel right. Day 1 of like malaise. Swabbed him, positive, started him literally after the positive test. So about 2 to 3 days in symptoms, right? He did great. He swears by the medication and says it saved my life.
Right.
Now, I have all sorts of other cases in between there, right? We've had thousands of patients. We had a lot of patients, right? How many have you tested? Do
you mind if I ask? How many have you tested total?
We've tested 20,000 people, Trump.
Wow, that's incredible. And what's your
20,000 people.
positive
Oh, it's
rate?
so low. It's so low. And it all depends on the range, right? When we were in the heyday, when it was very, very heavy here, it was still like 10 to 12%. Now, when you add all of them together, all of it over time, it's like 1%, 1.2%, 1.3%. But in the heyday, we were up, 12% positive. But we've tested a lot of people now, including people who had contacts but were asymptomatic. Now, as a reminder, we've also tested in nursing homes. And their rate is more. It's higher, right? But if you add all of them together, because we've had so many tests, we're at a very low rate. But we have so many cases that we've managed. And we do it through telemedicine most of the time, right? We do it through telemedicine. But Linda says it's safe to come back to Florida, right? Do you think it'll be safe for my parents to come back from Florida to Connecticut the end of July, right? And I answered Linda this the other day because I had my folks, they drove, they didn't fly, they drove from Florida. That was a risky thing, but we tried to do the precautions we could. So, Tro, to answer your question, anecdotally, there's something about it that I think works. And I don't know whether it's an anti-inflammatory component with it, like they do for, use it in Plaquenil, so use it for people with polymyositis and lupus and mixed connective tissue disease. I don't know whether it's the anti-inflammatory thing or it's this stuff that had been circulating along about how it attacks the red blood cells and how this is the case. I don't know. Now, in terms of it killing people, I want to see the... I'd like to see a subsegmental analysis.
When you overdose patients, maybe, right?
Yeah.
When you purposely overdose them at like 2 grams a day or something like 4 grams a day or whatever they're given.
Well, yeah. I mean, listen, the other problem is monitoring. Like, who's doing EKGs on these people and who's doing echo? Like, we have pods, right, where we do the ultrasounds, right, where we can do EKGs and monitor people. But a lot of people didn't do that. And they just couldn't do that. They just didn't have the stuff or the setup or whatever. My take with all of it is simple, right? Jury's still out, in my opinion. Jury is still out. And it's just because we just don't have enough data. We don't have enough data. That's it. And I think we need to get more. I think we need to look. And I think erring on the side of caution here is reasonable. I don't think it's bad to err on the side of caution. Sorry,
Did you see the recovery trial? Did you see how the lead researchers came up with their dosing? They mixed up hydroxychloroquine with I forget what it was, some other drug for dysentery.
Yeah, ivermectin, man, right? Yeah.
It was the hydroxyquinolones.
Right. No, you're right.
Overdosed patients. They were dosing Plaquenil at 2.5 grams per day.
Which you know as well as I do, that's insane.
Yeah, and then they said, why are people getting arrhythmias, right? This was the recovery trial. And,
that's right. I know what you're saying. You're right.
And then surges food tobacco. I mean, it's kind of anyway, I defer to you. What are you seeing? What else are you seeing?
So, a big thing for us is we test kids, right? And so we saw a bunch, back when it's really heavy duty, we saw a bunch of elevated CKMBs, a lot. And so these people ended up with echocardiograms. They ended up with troponins and LDHs. We saw sky-high ferritins in these patients. What I also saw was interesting, sugar management, right? Their insulin levels went up. Their hemoglobin A1Cs were really high. And does that mean that they're a poorly controlled diabetic? Probably. But their insulins were high. Their sugars were high. Their LDHs were high. Ferritins are very high. I saw a lot of high ferritins in people. Procalcitonins, CRPs, all of that stuff. The inflammatory stuff's off the charts. But we're seeing a subset, no more than 5%, maybe 10% of all that are infected still have stuff going on. There are 10% of them that we've had since March that we're still managing that still have problems.
Like chronic lung problems? You mean,
Not just lung, not just lung. These are people that I don't feel right. My head hurts. I have headaches. I still can't smell right. I can't smell right. I have numbness and tingle. I have burning paresthesias. So we've seen paresthesias. We've seen headaches. A lot of neurological sequelae. We have real incidents of kidney dysfunction. People that got hit in the kidneys. And then another one I see is GU stuff. Believe it or not, GU stuff. We actually. We're noticing some significant issues with testosterone levels. Sounds kind of crazy, but testosterone levels, right? And so we've seen.
Well, we know the viral, right? The viral, lumps and measles can definitely.
Right, it should go right to your testicles.
Endocrine, right?
Yeah, endocrine stuff. It's viral endocrine, and so when people, it's funny, Troy, you said that. I've been watching that stuff, the viral stuff in the endocrine system, just because, like you and me, right? Board certified bariatricians, part of our training is endo, right? It's endocrinology, right? And so endocrine, hormonal systems, right? These systems play a huge role. And so I checked these hormone labs in people, and there are real issues. The ACE2 receptors are in the testicles. They're in your testes. And so we're seeing real cases of bad endocrine hypogonadal dysfunction, right, going on. And so we have to manage patients this way. We have also seen hypothalamic pituitary axis stuff. Sometimes we can get that early by just checking, LH and FSH in our labs. So, we dig deep. So we've got a lot of data on that. Another thing that we are seeing right now with that small cadre of patients is the following. They are almost all uniformly carrying some level of low white count. So I won't call them leukopenic, right? Like they're still fighting off the virus, but it's like they're just turned down a little bit, low white counts, 2, 4. And so we were seeing that across the board. And I don't know why that is. But we're seeing that. As we test labs, but then we track them, right? We're going to trace them every 6 weeks or so. Sometimes if there was real dysfunction, like CK, we were checking them weekly. We're doing these labs weekly on patients. So, so that's what we're seeing. It's a lot better now. It's a lot better up here in Connecticut. And even in New York, we're in Bedford Hills. And so the positivity rates there are way less. We're testing corporations now. So we're doing some grocery store chains. We're testing their workers. Their carrier rate's really low, but we're pulling them off the floor, right?
That's amazing work.
If they're doing produce, it's crazy.
Thank you for having me, and maybe we can do this again. Maybe we got to get you on the podcast.
We got to talk, Tro, about your podcast. So listen, this is Tro Kalajian, right? Dr. Tro is a hero in the weight loss community.
I don't know if you can hear me.
Board certified bariatrician.
We're going to do that. We're going to get you on.
Just someday, right? We can talk about hypogonadism. We can talk about mitochondrial dysfunction in the adipocyte, right? We'll geek out a little bit. Listen, guys, this is Dr. Tro. He is one of my heroes in weight loss. He's an amazing, amazing man and a great doctor.
Another way around. Listen, have a good one.
And a great guy. Be good. Say hi to Ro for me. Take care of the kids. All right, take care. So that's it. So we're seeing a lot of crazy stuff. A lot of crazy stuff going on. That's why we track labs. We're going to continue to follow them. I've rambled on long enough right now, to be honest with all of you. Rambled on long enough. Here's the deal. He's out in Nyack, right? So he's out across the bridge over in Rockland County. One of the best weight loss doctors around, pound for pound. This is a man who suffered from obesity, significant morbid obesity. Went to multiple different doctors. They all told him to eat less and exercise more, right? It was only when he started changing his diet to a diet that was low carbohydrate was he able to successfully lose weight and then exercise, and then build muscle, and serve as a role model for his community. He's probably, honestly, he's just a tremendous doctor, Dr. Tro. Tremendous doctor, board-certified bariatrician and internist over in Rockland County. He's a great guy, great guy. And if I have patients in that area, highly recommend. He's amazing. He even does telemedicine visits. And so now he's got his license in Texas. He's got his license there. Like he's killing it, right? He does a lot of telemedicine. He's a very smart guy, very smart guy. So I'm going to wrap up. I'm going to recommend Dr. Tro highly. He's amazing. Linda, he is amazing, right? So you can go to drtro.com. I think that's his website, drtro.com, and you can go check him out and see what's going on. I'm going to wind down. I'm going to feed my kids a low carbohydrate, higher protein, higher fiber, higher complex fibers in the diet, good fats. I'm going to hydrate the girls and make sure they do okay. All right. It's Dr. Murphy, Murphy Medical Associates. I want to thank the governors again for the quarantine. Thanks for listening to me. Thank you for listening to me. All right. I appreciate all your hard work. I know you're working very hard. Right. The answer about the parents. Right. I'm not trying to run away from that. Coming from Florida to Connecticut is safe if they wear masks, right, and adhere to hygiene, right? If I fly people up, if they're going to fly up, get them N95 masks. Get them N95 masks. They saved healthcare workers on the front line. N95 masks saved healthcare workers on the front line. Got to get them those masks if they're going to travel. All right, that's if they're flying. This is Dr. Murphy, Murphy Medical Associates, and our team at coronatestct.com. It's coronatestct.com. I'm looking forward to your comments, telling you to have a great night, letting you know we love you guys. We want you to be safe. You're welcome, Linda. Have a great one. We'll talk to you soon. Good morning, everybody. How are you doing? This is Dr. Murphy, Murphy Medical Associates, reporting from the jungle of Connecticut. That's right, the jungle of Connecticut. Located very close to Disney's Adventureland. I am up this morning reviewing the news. Good morning, Linda. I'm reviewing the news and listening to my neighbor who is doing some work on their deck. Right, I can hear them doing work on their deck. A lot of people are doing work on their deck. And a lot of them are doing self-work because they can't afford to pay contractors. Good morning, Linda. Good morning. Monday morning, I will send out a few N95s for you and your family. I got your address, so I'm going to send them along. I am tired, Linda. I was up last night. I have patients in the hospital, so I had an admission. I had some work to do late last night. So I wanted to review a bunch of things today. I wanted to document a bunch of things. Today's the 27th, I think the 27th of June. Thanks, Linda. We've had a really, really long haul, right? We've been going at this since March, the weekend before. So probably March 1st, we started our planning or reviewing everything. And then over a weekend, we set up our drive-thrus. So we've been going nonstop, probably 24/7. And we do try and take Sundays off, but some Sundays we have to work. And on Father's Day, we worked, right? We tested, we treated, we isolated, and traced at a church in New Haven. So we were able to help them. Where we've been, where we're going, and where we are. That's 1, 2, and 3. But even more important than that is what is going on at the 30,000-foot level. Maybe even higher than that, right? So nationally and then internationally. Internationally, you have experiments like Sweden, where people are fighting about death rates and herd immunity. I want to talk a little bit about this. Right? I'm going to talk a little bit about this. This pandemic's been going on 9 months, not even a year. And a lot of assumptions have been made. Right? A lot of assumptions have been made. The first one of these is that there's going to be some sort of immunity, right? Why? Because that's how human body works, right? The human body works. Animal bodies work the same way. I mean, if you look at, they used to do these serum therapies. I don't know if you remember, but the microbial theory of disease, the theory that bugs infect us and cause disease, was really revolutionary, or truly revolutionary, and it led to massive improvements in sanitation in most of the world. This microbial theory, and as we've dissected through it to understand how our bodies react to different microbes, we've gotten pretty good at it. I wouldn't say we've gotten great, but we've gotten pretty good at it. You can just talk to any infectious disease doctor, and they'll tell you things always surprise them. Because we learn new things every day. The human body is inordinately complex. So to make an assumption that we're going to produce antibodies and we're going to have immunity passports and blah, 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 not so fast, right? There are a whole bunch of people that don't produce antibodies. I can tell you the COVID positive patients that we've had, more than a third of them have not made antibodies. More than a third of them have not made antibodies. That's concerning. That's very concerning. Sorry, I had to swat away a mosquito. I thought there were a lot of mosquitoes in the morning. So the assumption that you can get herd immunity, that's a risky premise. That's a risky premise, especially for a virus we know that is killing people that are vulnerable. And it's not just the elderly that are vulnerable for death. The obese. We're in America. Sky-high obesity rates. Okay? It's not just the elderly. It's number one. Number two, males, 50 years or older. We have those too. Hypertensive patients, diabetic patients, patients with kidney disease. We have all of these things. Absolutely all of them. And so we have real risks. In Sweden, they have a lot of hypertension. And so they have hypertensive risks for death, right? That's the way it is in a lot of Scandinavian countries. They have that risk. So are you willing to risk those people's lives for society? Now, in the United States, we have an interesting thing, right? It's called the reserve currency. Sweden doesn't have that. So all these other economies that kind of wreck their economies to lock things up, they're even more vulnerable than America. Most of them cannot print their way out of the problem. Now, in the United States, you can say, oh, well, we print the way out of our problem, and then we have more debt that we owe to other countries. Because, right, we have bond sales, we sell our T-bills, and then we print more money. Sometimes we can just conjure money out of thin air, right? That's the advantage we have as the reserve currency. There are other nations that wish they were the reserve currency, which makes a lot of sense, right? Because we can just conscript the printing press to give money, fiat currency, to our citizens that will pay for goods and services. Not a lot of other countries have that. Unfortunately, Sweden doesn't have that. Sweden doesn't have that. So you have to decide what strategy you're going to have. Are you going to shut down your economy, potentially exposing you to a depression? Or are you going to continue to keep your economy ramped up and running while accepting the risk of death, accepting the risk of infectious disease burden? And can your hospitals handle that burden or not? So, where was I? Yes, I was talking about financing and making political decisions of how to run your country or your state. States do not have the reserve currency. The federal government has the reserve currency, right? The United States, are they going to have to close down Connecticut again? I don't know. I do know this, Linda. I think Governor Lamont is doing some things very well, and I applaud him on those things. And when Governor Lamont does something not so smart, like stripping away personal protective equipment from private practices to deliver it to federally qualified healthcare centers and to hospitals, I think that's pretty stupid. If you want my honest opinion. We've been left to the wolves where the governor says, oh, there's tons of PPE, just go buy it. So, unlike us, although we too took a big financial hit and big risks, and I had to put a lot of stuff on my credit cards for the first 2 months before insurance companies paid. Now I can tell you insurance companies are doing dastardly things. They're doing dastardly things, including prepayment audits. So what does that mean? That means I have to buy all of my lab reagents and pay all of my payroll and wait for insurance companies to pay me. And now the insurance companies are saying, yeah, we get it's a pandemic, but we're not going to pay you until we see everyone's lab result. Here are 1,500 charts that we want. Here, 1,500 charts. Just give them to us. Well, that takes manpower, right? And my men are out in the field, my women are out in the field, and they're remote. So how do you get all of those records, right? So you have to pay the people to get the records, to submit the records. And we've done that. And you know what they've said? Oh, we didn't receive the records. I'm sorry, I didn't get it. So it delays payment. It's like a dirty dog game here going on with insurance companies. And they need to be regulated massively here because the chicanery that Cigna is pulling right now, it's insane. The chicanery that Aetna is pulling right now, it's insane. And now United Healthcare is back in the mix of doing bad things. So when you have to buy PPE, right, you have to buy the masks because you're exposed to coronavirus on a daily basis. When you have to buy the masks to protect your people, they're expensive. They're being price gouged. $5 a mask that used to cost $1 a mask, $2, right? And they're worried about us. And I'm worried about us too, because a lot of the private practices, they're going to go bankrupt. They finished their next round of the PPP, right? The Payroll Protection Program. They finished it. And now insurance companies are not paying. They're just not paying. And it's despicable. Let me tell you why. Because they're not paying for elective procedures, because there's not a lot of elective procedures going on. They're not paying for a lot of usual laboratories on patients and diagnoses. They're not paying for a lot of radiology. They're making windfall profits. So they need to pay. So Governor Lamont, Governor Cuomo, if you're listening, especially Governor Lamont, right? I get it. Our state is the insurance state. Capital of the United States. I get it. And they lobby and they pay for your re-election campaign, whereas private practice physicians don't, right? I get it. You're going where the bread is buttered. That's not how leadership works. You have to choke these insurance companies that are literally choking the lives of private practices. They're literally, private practice is public health in the community. Private practice has always been public health in the community, all right? They work with local departments of public health when they can. And most of the practices, to protect their workers and the citizens, shut their doors. So that way, sick patients did not infect healthy patients in private practices. These private practices are dying. When they decide to open, the insurance companies are exposing them to risk because they're not paying them. It's despicable. We go out in the field every day, exposing ourselves to coronavirus every day, and the insurance companies aren't paying us either. Where is the grant money going? It's going to hospitals. Where has the governor steered Medicare and Medicaid services? To the federally qualified health centers. Has any of it gone to private practices? And in fact, there's scuttlebutt in the state of Connecticut that they're going to literally gut pediatricians, gut private practice pediatricians. Why? Because they're going to take all the vaccines and you can go get them at CVS or Walgreens. Okay. As long as CVS and Walgreens is going to do the good follow-up care with those patients. That's what pediatricians do. Literally destroying private practice. That's what's going on. So where are we headed? We're headed to the destruction of private practice. And the destruction of listen, CVS and Walgreens can be convenient, but there are doctors that have a lifetime relationship with their patients. They can't afford to open. Pediatricians everywhere getting shut out. Their volumes are down 80-90%. They can't make ends meet. And then they're going to get bought by hospitals. And when hospitals buy them, then costs will really go up. How do we know? Time after time after time, study after study after study show that once a doctor is owned by a healthcare system, costs go up. Quality, on the other hand, goes down. Quality goes down. There's been many metrics showing this. Patient satisfaction goes down. Goes down. Patient satisfaction goes down. When you get bought by a hospital healthcare system, the patients don't benefit at all. They don't. No matter how much you can say the bells and the whistles. So, Governor Lamont, your team is doing the wrong thing. Listen to me, please. You listen to me with the quarantine recommendation. I appreciate that. So we shouldn't be working to strengthen monopolies. We should be working to support those private practices. We really should. Linda. So let me tell you what's going on, right? We are working with some assisted living facilities and some independent living facilities in Glastonbury. We're helping test their employees, helping treat their employees, and we're going to work on offering telemedicine visits with our team with their residents. So we're already kind of there. But to have a physical presence in Hartford right now, without having a medical reserve corps, someone to help assist us volunteer-wise, or to have a team train, it's been a very difficult challenge. Right now, we're answering the call in New York City. And I've been down a few times speaking to the borough president's office in Brooklyn, trying to help jumpstart what I think will be another wave down there, right? To jumpstart the tracking to identify that, right? In Brooklyn and Queens, these are zones that are higher risk given the travel that happens, right? I mean, listen, you got the airports out there, right? You got the airports out there, more so in Queens, but it travels to Brooklyn, right? And with the subway and with public transportation, there are real issues in a hotbed of infection that can happen again, right? It's just, you just got to light the fire and it can happen again. So we're working on helping them down there. We're working in Westchester County. This is where we are now, right? We're working in New Haven County. We opened up evening hours for testing in West Haven, and that was huge. The lesson that taught me is we should have nighttime testing centers, right? Doctors' offices should be open in nighttime. Patients need us during the nighttime, and it'll avoid emergency room visits. It'll avoid costly emergency room visits. The problem is, who wants to work at nighttime? And so that's been difficult hiring people, especially now with the global pandemic. Practices don't have the money. Hi, me. Right? It's one of my kids waving in the window while I'm blabbing away. Yeah, I will. Just give me a couple seconds and I'll be back inside. Okay? Kids call me. So, where are we now? Multiple sites, approximately 10 sites at any given time. We're doing telemedicine. My team is contact tracing. We are contact tracing because we get the results right away. They spit right off of our lab equipment. Luckily, we made the right choices in terms of lab equipment to be able to get access to coronavirus testing. It isn't from lack of trying. I've tried to get 5 or 6 different pieces of equipment. All of the, again, like the PPE, all of the reagents and all of the lab equipment has been steered to hospitals. In addition, I was worried because at federally qualified health centers, they were all relying on the Abbott machine, which has like a 30 to 50% false negative rate, depending on the study. So they were getting subpar equipment, releasing into the field people who could potentially have the virus. We didn't want that. We didn't want that at all. And so BioMaru has helped us immensely. They've been giving us reagents that, by the way, are expensive. I mean, we're talking millions of dollars in cost. A lot of private practices couldn't do this, right? I'm lucky I have good credit. Not a lot of practices do. They've been gutted. And so BioMaru has been helping us big time with this. Their division out in Colorado, out in Utah, is doing a great job in Salt Lake City. And they've been shipping us reagents regularly. Our unique design has enabled us to provide other care, right? To provide timely ultrasounds to evaluate people who've had clots in their legs or in their lungs, who have had myocarditis, right? We've been able to detect that stuff. We've been able to look at kidney arteries to look for clots and high flow states there. You know, the kidneys are a low resistance bed. And so one of the things I'm studying for is, what they call the registered physician vascular interpreter. And so the physiology of it's been fantastic. So, you know, when a vascular bed's resistance changes, then you have to really worry about it. This is notable in the kidneys, as we see that there are kidney clots, right? Kidney clots that are happening when your D-dimer is elevated. So, where are we going? I believe that the southern states are experiencing the first wave now. The data that I have seen on these all suggest a spike or a peak and then a drop off. Because once the levels get high enough, everyone gets scared. Once the levels get high enough, everyone gets scared. And the only people that are willing to expose themselves to the virus are the frontline healthcare workers and the first responders, right? Frontline healthcare workers and the first responders. They run into the fire, which is the coronavirus fire. And they put their families at risk, right? They put their families at risk. Study found out that 50%, almost 50% of healthcare workers are living away from their children and family so as not to affect them, right? They're living in a different room or in a different part of their house, or some of them aren't even living at home, just FaceTiming their children to keep them safe. So I reiterate, there are a lot of doctors out there who are getting crushed right now. There are a lot of healthcare workers that are getting crushed right now. In the states of Texas, in the states of Florida, you can go into Georgia's data, Alabama's data, in the South. It's real, it's significant. They're experiencing the first wave. We will meet, I'm sure of it. In the Northeast, the Acela corridor, right, that people in the South like to shout at us because we're damn Yankees. In the Acela corridor, we were scared. We were concerned. And we've maintained social distancing, but we're starting to get tired. That bar in New Haven that was shut down, it was shut down for a reason. But we have conflicting needs here going on, right? Everyone that makes their revenue off of rent, off of services, off of non-essential goods, off of non-essential services, right? Barbers and those things. Not everyone can adapt. If you've invested in a bar, you need to pour liquor. Otherwise, you go bankrupt quick. So there are people taking risks. Why? Because they're desperate. Why are they desperate? They are desperate because they cannot make money. Yeah, I know. Gyms are going to be the worst of it. They have to pack people in. Their business model does not work unless they oversubscribe members. The whole, whatever your business is, your model has to change. At least to survive through this pandemic. At least to survive through this pandemic, until we have appropriate treatments that are really good, until we have a vaccine which works, if we have a vaccine which works. Business models have to change. Everyone has to totally switch off the mindset of, I'm just going to do it like I've always done it because it's been very successful, because that's not the way it's going to work. So, Governor, we have to help educate, right? And one of the best ways to do that, I know, because I take care of a lot of small business people. And you know what they do? They come to me and they say, Doc, how do I need to change my business for this pandemic? Public health in the community. That's what we need right now. Okay? So I think we will have a second wave. I don't think it's going to be terribly horrible, but I think it's going to be reasonably horrible. I think that the changing with pooling of testing, I think is a big risk. Let me tell you why. We don't have enough capacity for the accurate machines to be located everywhere. We just don't have it. And because we don't have it, we may be pooling risk on machines that are not accurate. Which in a higher incidence state and a higher prevalence state, you're going to miss positive cases. So I think we got some problems. There is a ray of hope, though. If we can support our private practice physicians, everything is going to end up in a red zone. Governor Lamont, Governor Cuomo, Governor Murphy, support your private practices. They are public health in the community. This is Dr. Murphy, Murphy Medical Associates, signing off. Have a great day. Enjoy your Saturday. Looks like it's going to rain here. I can feel it in my ribs. All right. Love you guys. Be good to each other. Dr. Murphy, Murphy Medical Associates, and our team at coronatestct.com. It's coronatestct.com. You can register and get tested at any of our sites.